carotid artery. Let's talk about the external carotid artery. External carotid artery is a very busy artery in the neck. It is the one that is supplying most of the structures of the face and the neck and occiput region also. Let's talk about its origin and termination. First, origin, root, and termination. Then we'll go to the branches. Origin. Let me go back to the model again. So, okay. Let's follow here. So, it the origin part of the external carotid artery is the same point as the termination part of the internal common carotid artery, that is the bifurcation at the level of thyroid cartilage or hyoid bone. It then runs upwards towards the angle of the jaw, like here, just behind it, into the carotid gland in front of the ear, and it comes right here. It goes like this. From here it goes up just behind the angle of the mandible, then on the lateral aspect of the ramus and the carotid gland, and here in front of the tragus it divides right here. Let's follow it, nerve, right? Let's follow this artery. Okay, this is the common carotid artery, as you can see highlighted. So it is originating at this point at the bifurcation. It is moving up. Just note the point that it is moving behind. It is not behind. It is moving deep to the muscles that are originating from styloid. This was the two muscles that are going to the hyoid bone, the digastric muscle and the stylohyoid muscle. So it is passing deep to it. It passes through the thyroid gland, not shown in the picture here, and it moves up just below the condylar process, just below the head of the mandible. It divides into two main branches. You may see a lot of things, but if you are able to ignore and see the two things, this is the superficial temporal artery that will go and supply this temporal area of your scalp. And this is the maxillary artery. It's a whole new Pandora box. It is a 14 to 15 branches. We will go through them one again. So these are the two branches, and this is the terminal bifurcation of the common carotid, external carotid artery. So this is the external carotid artery, and this is how we demarcate its surface anatomy. We find the upper end of the origin point of the common carotid, origin point of the external carotid artery, as we saw in the surface anatomy. Let me go to the skin. Let's do it like this. So roughly, right here was the bifurcation point. Right here was the bifurcation point. We made the bifurcation point just like find the sternoclavicular joint and move up vertically till you reach the thyroid cartilage. Then you go to the behind the angle of the mandible. This is called the tragus of the ear, and just in front of the tragus of the ear. So this is where the external carotid artery runs. So this is where the external carotid artery runs. We can check it. We may be in the ballpark. So almost this is where the external carotid artery runs. So these are the points where you actually feel the pulsation. Just in front of your ear, just in front of your tragus, you feel the external carotid artery. So this is about the root of the external carotid artery. Then its branches. Let me get you to this slide and let me set up the 3D model. Just give me a second. So you may read the slide. Okay. Just 1 second. Okay. Branches. There are, interestingly enough, there are 8 branches. Some of the branches, about 3 branches, are emerging from the anterior aspect. 2 are from the posterior aspect. There are 2 terminal branches and 1 medial branches. I will go through them one by one. Let's talk about the branches that you have already read the name of. So the 2 branches that we already discussed are the ones that are forming the termination point. So this was the external carotid artery. This was the external carotid artery right here, and here it was dividing into the maxillary artery and the superficial temporal artery. So we are done with 2 branches, maxillary artery and superficial temporal artery. Here is the maxillary artery and here is the superficial temporal artery. These are the first 2 branches. It is easy to remember because these are the terminating points of the common in external carotid artery. Let's discuss the three arteries that are originating from the anterior aspect. So if we are looking from this view, you can see right here, here, and here. There are three branches that are coming from the anterior aspect of the common carotid external carotid artery, and you can see they are diverging like this. One is going up, down, one is going up, and one is going almost horizontally. So the one that is going down, this one, this is ultimately going to the upper end of the thyroid gland below. So this is the superior thyroid artery. We'll get to their branches in short while. The one that is going almost horizontally, this is the lingual artery. It will go and it will supply the tongue area. And the one that is going roughly upwards, it is the facial artery. It will go up and into the face, and it will go all the way up to the medial aspect of your eye right here, and it will supply those. So we're done with 5 branches. Let me repeat. We talked about the 2 terminal branches, superficial, temporal, and maxillary. We talked about 3 branches that are moving from the anterior aspect: superior thyroid artery, lingual artery, and facial artery. There may be a common origin of facial artery and the lingual artery, and that is known as linguofacial artery or facial linguofacial artery, that is usually known as. So 5, we are left with 3 branches. Okay. So we have discussed the terminal, we have discussed the anterior, then the 2 posterior arteries. The 2 posterior arteries that are going to the back of the head. So here you are able to see them. The one that is the bigger one that goes all the way to the back, this one, I'm not able to click on it. This one, this is the occipital artery. This one is known as the occipital artery. So this goes all the way back. It passes through the sternocleidomastoid and goes all the way back to the occipital region of the skull. And then there is this one that is known as the post-auricular artery. Posterior auricular artery, by the name, as you can understand, that it is running on the posterior aspect of the ear, posterior auricular artery. Let me get back to the presentation. Here, let's follow them one by one. Okay. Uh, the 2 terminal branches. The first, the root from the bifurcation at the level of thyroid cartilage, move around the angle back in front of the tragus. Here it divided into maxillary, superficial, temporal. 2 branches, then 3 branches in the front. The one going down, that is the external, that is the superior thyroid. One going almost horizontally below the hyoglossus and the mylohyoid, below mine, deep to the these muscles going to the tongue. One is going like there below the angle of the jaw, and it will emerge from here. We will discuss it shortly. That is the facial. 5. Then the 2 that are going back, the one, the larger one, emerging from the lower aspect just behind the facial or lingual. This is the occipital artery. It moves back behind the sternocleidomastoid muscle. By behind, I mean deep to the sternocleidomastoid muscle and digastric, and it emerges from its origin point and it goes to the back of the skull. And there is this posterior auricular. It moves below and parallel to the stylohyoid and move just in front of the sternocleidomastoid and back of the ear to supply the region just behind the ear. And then we are left with one artery that is known as ascending pharyngeal artery. So ascending pharyngeal artery is a little difficult to see in the those pictures. Let me see. I think it is not seen shown here also. Let me try to get it here. Then I will show in the atlas also. Ascending pharyngeal artery is on the left side. You're not very easily seen in the atlas because it is totally on the medial aspect. So it is going and ascending pharynx. So it is basically hidden by the external carotid artery. You may see, if we look from here, you can see it going upwards and behind the external carotid artery. So it is originating from the medial aspect, and that is why we are not very much able to see it. So here you can see just the origin point: ascending pharyngeal artery, superior thyroid, lingual, facial, and here. There are a few relations that are very commonly asked. One of these is this relation. This one is very commonly asked in the examination. This relation, one a minute, and this relation is asked very commonly in the question. So what are these relations? So number one, talking about this one, the lingual artery, it's crossed laterally by hypoglossal nerve. It is very common in the MCQs in the past papers due to some reason. So it is an important landmark when doing maxillofacial surgery right here. So lingual artery, it's related to the hypoglossal nerve, and hypoglossal nerve is lateral to the lingual artery. And here we will go into the detail of the branches of the nerves when the cranial part section, inshallah. And here is the again relation of the hypoglossal nerve with the occipital artery. But in this particular case, hypoglossal nerve is deeper, hypoglossal nerve is medial to the artery that is the occipital artery. And here one more question arises that it is a little troubling for you, or for most of us, at least it was for me. The occipital artery, it has two branches, both of them are supplying the sternocleidomastoid, the lower one and the upper one. These are both supplying the sternocleidomastoid. The MCQ that comes here is this. You can see the hypoglossal nerve coming right here, moving just around the external occipital artery, and winding around it to go front, and it winding ground around it to go front, and it is held in this place by this branch, inferior branch of sternocleidomastoid artery. So this is the point. And another MCQ comes, the superior branch of the occipital artery that supplies the sternocleidomastoid. It is running almost near the accessory nerve. Sorry. So it is a indication of that nerve. It, this relation comes in handy. Okay, this is a little heavy picture. I don't want you to go through it all at once. Let me break it a little for you. I just want to discuss the branches of these branches. So, first, let's talk about the external thyroid artery. External thyroid artery. So, here the external thyroid artery is originating from the common external carotid artery. So, it has a few branches. There is a branch that goes into the larynx, that is called superior laryngeal artery. It pierces the thyroid membrane and goes down. There is also a branch not shown right here that runs just here parallel to the hyoid bone, that is known as infrahyoid artery. That is known as infrahyoid artery. So there are also branches going to the sternocleidomastoid. Let's ignore them. Superior laryngeal, and then there is this branch that is going to supply cricothyroid muscle right here. So this is known as cricothyroid artery. This one, and then we are left with the one that is actually going to the thyroid gland. That is the part that is going to the thyroid gland. It is further divided into the anterior division that is go to the anterior surface, and the posterior division that goes back, and then it will, one of them will go to the isthmus and all that. So superior thyroid, talking about the superior thyroid artery, I discussed the branches. There is infrathyroid artery, the superior laryngeal artery, the one that is going to the cricothyroid, the two anterior and posterior divisions of the thyroid, and there is one going to the sternocleidomastoid also. Okay, let's erase this. Let's talk about the next ones. Ascending pharyngeal artery, there is not much to talk about. In this particular picture, you can see it right here. It is going back and up on the lateral aspect of the pharynx, and it will move in the pharynx and it will supply this. Lingual artery, let's follow the lingual artery a little. Let's follow the lingual artery and leave it for the oral cavity. Okay, here is the lingual artery, the one that is running right here. The lingual artery, it arises at the level of the hyoid bone, where the tip of the hyoid bone is at meeting near the common external carotid artery. It goes back. The muscle relation that you have to remember is this one. The muscle that is present right here, this one, this muscle, this is the hyoglossus muscle. We will discuss about it in the oral cavity lectures. This is the muscle that is moving from the hide bone and it is moving to the glossus, the tongue. So that is known as hyoglossus muscle. So there are two MCQs regarding the lingual artery. One is that the lingual artery, it goes to the medial aspect of the hyoglossus. It will go inside the hyoglossus and it will go into the oral cavity region. If it stays out, it won't be able to go to the tongue. So there is one question. It is medial to the hyoglossus. And the second question we discussed earlier, the relationship with the hypoglossal nerve. It's the relationship with the hypoglossal nerve. The hypoglossal nerve just passes lateral to the lingual artery. So this is about lingual artery that I wanted to discuss. If you are interested and if you are not interested, then you can forget it also. It has a small branch that moves on the upper aspect of the hide bone. So simply speaking, its name is suprahyoid artery. So this is about lingual artery. Facial artery is complex. Facial artery is complex a little. Let me get it to the chin, and from the chin aspect here onwards, we will discuss in the facial artery. We will discuss separately. So it arises right here. It moves to the front, and before it reaches the lower margin of the mandible, before it reaches the submandibular fossa, it gives rise to two branches. These are the branches. I'm just naming them because they will be important to you when we're talking about pharynx. So these are the branches that are going upwards. You don't have to remember a root of a lot by very detail. These are known as, one of them is going to the palate, ascending palatine artery, and one of them is going to the tonsillar bed. So this is the ascending palatine artery. It is going all the way up on the lateral aspect of the superior constrictor, up across it to the palate, and this is the one that is going up through the superior constrictor into the tonsillar bed, tonsillar fossa. So these are the arteries. Then it enters the submandibular fossa. Submandibular fossa is the same as the submandibular space, the submandibular triangle, the digastric triangle that we discussed in the previous lectures. It gets on the basically on the medial aspect of the submandibular gland, and it of let's talk about this picture. On this picture, if this is the submandibular gland, this is the lateral aspect, this is the medial aspect. This is the lateral, superior, medial, inferior aspect. Facial artery comes from back. It approaches it from the posteromedial aspect. It curves above it on the superior aspect, goes over it to the lateral aspect, and it reaches the lower margin of the mandible. So it is the relation. The facial artery, it moves from the posteromedial aspect to above and to the lateral of the submandibular gland before moving into that. So this is the curve that is shown right here. It is moving posteromedial aspect. It is above and lateral to the submandibular gland, and it reaches the lower margin of the mandible. And at the lower margin of the mandible, you can palpate it like here. There are two ways to palpate it. Clench your teeth. If you clench your teeth, you will be able to figure out this muscle. This is masseter muscle. You won't be able to very much identify it in the flaccid position, but if you clench your teeth, this is the masseter muscle. Just follow its anterior margin and get to the point where it meets the margin of the mandible. So this is the point where you will find the pulse of the facial artery. And the second thing is that at this point, the bone has a little notch. Some people have a little, most of the people have a notch like this. So if you palpate the lower margin of the mandible, you will feel a little gap, a little dip, a little notch right here. So in the notch, you can palpate the artery. So this is the facial artery. So we talked about the branches of the superior thyroid arteries, infrahyoid, superior laryngeal, pericothyroid, anterior posterior thyroid, and sternocleidomastoid. We talked about lingual artery originating at the tip of the hide bone, at the greater horn of the hide bone, giving rise to suprahyoid artery and going medial to the hyoglossus, and it is itself medial to the hypoglossal nerve. And then we talk about the facial artery. It is originating just opposite to the occipital artery anteriorly. Before reaching the submandibular fossa, it is giving rise to the tonsillar and ascending palatine arteries. They are going to the areas of the same name. Then it is moving over and to the lateral of the submandibular gland to reach the lower margin of the mandible, and from it moves up. Here you can actually feel the pulse of the facial artery. and before actually entering the face, it gives rise to this artery. This is the artery that moves all the way here and just supply at the lower margin of the mandible. That is known as submental artery because it's going to the submental triangle. Is a submental artery. So these are the branches of the facial artery that we forget to talk about because we are so much fixated on facial artery being on the face. So this is the facial artery. Then the occipital artery was the one that was going on the back. I talked about the hypoglossal nerve winding around it. Then there is this posterior auricular artery moving on the anterior margin of sternocleidomastoid, leaving the tip of the posterior triangle and going on the back aspect of the chest ear. And then there is superficial temporal artery, and then there is maxillary artery and maxillary artery, a hell of lot of branches. So we will talk about them when we're talking about the infratemporal fossa in detail. I'm just going to show you how many branches are originating from maxillary artery. All you can see right here. So just don't go into the detail. So here, so we are done with external carotid artery, or at least I hope we are done with the external carotid artery. So you can take a, if you want to take a little breather, but let's do the internal carotid artery, then we'll take a little break.